Here's another true and false for the knee. Do the hip muscles cross the knee? Watch this and see if you're right.
As you can see, there's lots of muscles here, and these are the muscles above the knee. You can see all the quadriceps. It's called quadriceps because there's 4 muscles in your quads. I want you to notice the vastus medialis. And that muscle kind of comes down low and inside, just above that patella. That muscle is really important for helping that kneecap to do a nice little arc as your knee straightens, so that it follows that perfect line from behind it and it doesn't annoy any structures. So if that vastus medialis oblique, actually VMO, isn't functioning properly, that can radically affect and alter the tracking of your kneecap. And patellar tracking is something that you would want looked at if you think you've got a problem with the structure of your knee and you've got pain and that kind of thing, but we'll be getting into that a little bit more later. So you can see here I'm showing you all these muscles in the hip as well, because all of these muscles, you can see they begin at the hip and they end at the knee. So how is it that the hip doesn't affect the knee? That doesn't even make sense. If those muscles are attached to both joints, obviously if something's going on at the hip, it's going to create this abnormal function down at the knee because the muscles are attached to both joints. You can see here how huge that gluteus maximus muscle is, that butt muscle. It's your most powerful muscle in the body, and your glutes pretty much rule what happens to your knee. And it's very important that they're functioning properly, that they have good solid strength and power, so that your knee is not getting annoyed because they're not working right. And of course, all of these other muscles will have a role as well. So here's the calf muscles below the knee, and they are just as important. They affect the knee. And as you can see, they attach to the knee and the ankle. So again, your ankle will have a radical function affecting your knee. If your ankle has lost motion because you had an ankle sprain, if your ankle is not strong and stable, it will force extra work on the knee. There is such a, and I won't go into all the details of this, but there is such a specific trigger of things that have to occur when, even with just walking, as soon as that heel hits the ground, all kinds of things are happening because your heel bone is doing a certain thing, and then that triggers something else and triggers something else and triggers something else, and all those things have to happen in this perfect cascade of timing, this perfect chain reaction that has to occur so that the knee is not getting irritated and annoyed and making up for something that did not occur.